Hello, everyone. Welcome to our first module. Um, for these PowerPoint presentations, the purpose of these are going to be just to give you kind of a brief introduction and overview to the chapter that we'll be covering in the module. I'll be looking particularly at applications of the information from the chapter and what this might look like in your practice in the future. For all the detailed information about all the assessments, you'll find that in the chapters as you read the textbook. So, like I said, the goal of this is mainly to give you that introduction and to point out some of the main features that you might use in the future as a counselor. So, this first module that we're going to be looking at is from Hayes chapter 13, looking at the assessment of personality. So when we look at personality assessment, I'm sure probably what comes to mind first would be personality assessments associated with things like Myers-Briggs or, today, Enneagram is something that's really popular and really important. And so when we're talking about personality assessment, yes, we are looking at assessments related to some of that interpersonal functioning, intrapersonal functioning. But that's not all that falls underneath this category. So when we look at personality assessment, there are various purposes for the different assessments that fall into this category. So one area of personality assessment is really focused on examining psychopathology and behavioral problems. So, as you know, within the DSM, there's a whole section looking at personality disorders. And so, when we're talking about personality assessment, we're also looking at the personality from the perspective of psychopathology and from the perspective of diagnosis when it comes to dysfunctions in the personality and when it comes to different behavioral problems that might come from some of those dysfunctions. So one category that falls under this umbrella of personality assessment would be those types of assessments that really look at psychopathology and are part of the process of diagnosis in that area. And then the other part that falls, or kind of assessments that falls under that umbrella are the ones that you might think of first, right? Those the assessments that look at intrapsychic dynamics and interpersonal functioning. How can you understand yourself as an individual and maybe also understand your relationships and how you relate to others? So I want you to keep that in mind as we look at these different assessments, that we're really kind of talking about a few different purposes there. There are also different types of formats when it comes to personality assessment. So the first format that we often find are our structured personality assessments. These are objective assessments. They tend to be standardized self-report measures. Generally, they're going to use some kind of forced choice response format. So maybe multiple choice, maybe true false. These are going to be the types of assessments that you will most likely find yourself using as counselors in the future. The other format of personality assessments that you might find are more of your unstructured personality assessments. These are projective assessments. When a client or an individual is given a projective assessment, they're given different unstructured tasks, and we'll talk a little bit later about what some of those tasks might look like. So they're given these tasks, they're asked to complete those tasks, and then the way that they complete those tasks are then analyzed by the test administrator. And so these assessments are really based on something called the projective hypothesis. This hypothesis says that responses to ambiguous stimuli reflect back a person's basic personality. So how someone responds to a stimuli that is kind of a neutral, ambiguous stimuli, that their response to that stimuli tells us about their basic personality. It tells us about their basic needs as a human, the experiences they've had in their life. It tells us about their inner states and their thought processes. And so we'll talk a little bit more about how these projective assessments tend to work. This is an area that most states, counselors, master's level counselors, generally don't have the qualifications to be able to do projective assessments. These generally take a lot more training and experience. Oftentimes you're looking at PhD level therapists who will be giving these types of assessments. So these are ones that maybe if you end up referring your client out to a psychologist for formal testing or more testing, the psychologist might be conducting some of these types of projective assessments. So we're going to talk about all of these as we move forward in a little bit more depth. All right, so we're going to start with structured personality assessments. So I'm splitting this into two different sections, going back to those two different purposes of the personality assessment. So we're going to start by looking at some of the structured assessments that are associated with assessing psychopathology and behavioral issues. So one of the most popular or most well-known assessments that is used in this area is the MMPI, which you've probably heard of, right? The Minnesota Multiphasic Personality Inventory. This is a very popular inventory. It is also very expensive and also takes extensive training and experience to be able to administer. So this is another one of those assessments where oftentimes as a counselor, you're not going to find yourself giving this assessment to your clients most likely, unless this becomes an area of specialty for you that you pursue with extra training. Generally, this would be another one of those assessments that you might refer, if it's indicated, you might refer your client to a psychologist or to a testing facility where they might go through this assessment. And then you might be getting the results back to look at those results. So the MMPI has psychiatric diagnostic categories. So this is used in the process of diagnosis. Personality disorders and issues with the personality, those are very serious diagnoses that oftentimes can have lifelong implications for your clients. Often with personality disorders, those are not things that at one point that a client is cured of or that they don't have anymore. These are diagnoses that if a client has, they're going to be managing them for their whole life. And so because of that, when we're looking at diagnosing disorders related to personality, we want to make sure that we're really thorough in that process because of those implications. And so assessments like the MMPI can be useful resources and tools in that process of diagnosis. Now, even the MMPI talks about how it shouldn't be used alone, right? That there's a lot of context that you want to use in interpreting the results, and there are other assessments that might be helpful within an assessment battery to get a full picture. But the purpose of the MMPI is really to evaluate your clients for different mental disorders and to aid you in treatment planning. It will give you extensive information about a client's functioning in a lot of different areas. It's also known for its validity scales. So it has multiple validity scales that are built into the assessment for you to be able to identify the client's feelings and beliefs towards the assessment process, right? And so you'll get a good idea of how your client was also interacting with the test to see if there might be any response bias in the way that they were responding to the personality assessment. Because one of the things that you want to keep in mind with structured assessments is that there can be some of that motivation to either overperform or underperform on the assessment depending on kind of the goal. So if a client wants a diagnosis, they might respond with more severe responses, right? If someone doesn't want that diagnosis or doesn't want to meet a clinical threshold, right? They might under-report and under-respond. And so one of the benefits of the MMPI is that it does have these validity scales within the assessment that can um, help clinicians as they're interpreting the results to see if there might be bias that is a part of those results, which can then inform what you do with those results. So the MMPI, like I said, is one of the most popular personality assessments dealing with psychopathology and behavioral issues. Another popular assessment in this category is the Milan Clinical Multi-Axial Inventory. The purpose of this assessment is, again, to diagnose psychopathology. This assessment is based on the DSM-5, and so it closely follows diagnostic categories from the DSM-5. This can be used to help identify normal to clinical personality levels. And so the way that this assessment conceptualizes personality is on a continuum of 3 levels. So it starts with normal adaptive functioning, abnormal, moderately maladaptive attributes, and then clinical disorder. And so this assessment really helps the counselor to identify areas within the client that need the most therapeutic attention, right? So it's going to help in the diagnostic process, but it's also going to help in that treatment planning to help you as a clinician identify where you might need to focus your treatment goals and your treatment plan to best help your client. Another popular assessment is the NEO Personality Inventory. This assessment was developed to assess the big 5 personality factors. And so you'll read in your textbook about a factor analytic method that really boiled down personality to these 5 personality factors. So looking at neuroticism, which is on a spectrum from someone who is very insecure to very self-confident, extroversion, which is outgoing versus shy, openness, imaginative versus concrete, agreeableness which is empathic versus hostile, and conscientiousness, well-organized versus impulsive. And so the NEO specifically assesses an individual related to these different personality factors, and depending on their response, again, has implications for diagnosis as well as treatment planning. So these are all assessments that if your client is showing signs of kind of dysfunctional behaviors related to the personality, some of these assessments might be helpful in that process of diagnosing any potential personality disorders or behavioral issues, and helping you again to tailor your treatment to meet their needs. Your book talks about some other assessments that also fall under that category, but I'll let you read about those in more detail in your textbook. So as we move on to the other kind of purpose within personality assessment, that purpose is around the idea of personality styles or personality types, right? Understanding the individual, their interpersonal functioning as well as their interpersonal functioning. And so these are also, again, under those structured assessment umbrella, but have a little bit of that different purpose. So we're not looking at psychopathology, we're not looking at diagnosis, we're simply looking at how someone functions as an individual and in relationship with others. And so I'm going to point out 2 of the assessments that would fall into this category. So one is the Myers-Briggs Type Indicator. So again, this is probably one of the most popular assessments around this topic, probably one that you have heard of before, And I would bet that probably most of you have taken it at some point throughout either an educational experience or even a work place experience, because this is commonly used in that process. So the Myers-Briggs Type Indicator assesses 4 different dimensions of personality. So it uses, it has these bimodal dimensions, right, where you look at 2 different types for each one. So one of the dimensions it looks at is extroversion versus introversion. The next one is sensing versus intuition, thinking versus feeling, and then judging versus perceiving. And so within the assessment, you will get one of those categories for each of the dimensions, which creates a 4-letter code. And overall, there are 16 different personality types. So for example, when I've taken the Myers-Briggs type indicator before, I've gotten an ENFP would be my personality type. So that would mean that I would fall under extroversion, intuition, feeling, and perceiving, right? And so based on that 4-letter code, that gives me some insight into how I function as an individual and how I function in the world around me and in the relationships around me. So this type of assessment is really used to help clients develop self-awareness. So if you're working with a client who maybe is running into kind of issues or just problems in their daily life, and maybe some of that comes from a lack of awareness of their own functioning, this can be really helpful as a way to help build in some of that self-awareness for the client. This is also commonly used in couples counseling and family counseling to explore relationships between couples or family members, right? There can be a lot of insight that's gained in knowing how you function and your personality functions, and how someone you are in close relationship, how their personality functions, and how those personalities might interact with one another. Right? So a pretty useful tool in couples and family counseling. This is also something that is commonly used in career counseling to help individuals better know themselves in order to better choose a career. But then also, oftentimes within the process of the workplace, right, the Myers-Briggs is often used in ways to build teamwork and to understand your relationships within the workplace as well. Right? So a pretty common personality assessment that's used for the purpose of kind of knowing yourself and others better. Another personality assessment that would fall kind of under this category would be the Milan Index of Personality Styles. So this is for kind of normal functioning personality only, right? So the previous Milan assessment was for psychopathology. So often looking for kind of that diagnosis. But this one is specifically looking at understanding personality styles. So this assessment theorizes that there are 3 dimensions of normal personality. So it looks at motivating styles, thinking styles, and behaving styles, right? And so your results are going to be around those different styles and information around those styles and how you function within those styles. This again is intended for counseling settings that involve relationships, that might involve career placement, or again, just problems in daily living where maybe a client lacks some self-awareness, and this might be a helpful tool for them to help engage in that self-awareness. All right, so those were some of the structured assessments that were discussed in your book. Again, there are many more in the book, and so make sure that you read the full chapter and look at the details of some of those, because it will be covered in the quiz that's connected to this module. So moving on to unstructured personality assessments. So when we talk about unstructured personality assessments, we're talking about projective assessment. Projective assessments are generally used to generate hypotheses and examine intrapsychic dynamics. Okay, so projective assessments typically are not used to diagnose, they're not used to determine psychopathology or to look at behavior problems. These really more fall into that purpose of kind of understanding the individual and their functioning. So again, projective assessment allows for an individual to have multiple responses towards ambiguous stimuli. And so the individual is given this ambiguous stimuli, they respond to that stimuli, and then those responses are classified to provide general impressions and inferences regarding a person's personality. And so a lot of these different projective assessments will have different classifications and how you're going to interpret what they're talking about. What are the themes that you're looking for in the responses? And all of that then gives you information that allows you to create a hypothesis and make these general impressions and inferences about their personalities. When it comes to projective assessment, a lot of the interpretations of these assessments have generally drawn on psychoanalytic theory. And so you'll see a lot of influence from that theory in this type of assessment. Administration and scoring of most projective instruments require considerable training and experience. So again, this is a format of testing that you most likely yourself will not be administering. Generally, again, this type of assessment is done by someone with a PhD level education and extensive training in the area. Which, as you can imagine, because there's so much interpretation involved in this, right, there's also a lot more that's involved in being able to administer, score, and interpret these types of assessments as well. So not something you might do on your own, but something to be aware of because your clients who, you might be getting assessment results back from testing that has been done with your clients, assessments that have been done with your client, or you might refer your client to more extensive testing, and so you might get results back from projective assessments such as these. So when we're talking about projective assessments, there are 5 main types of projective techniques. So when we're talking about that kind of ambiguous stimuli, these are the types of stimuli that are provided to the individual who's taking the test. So the first technique would be associations to ink blots or words, right? So the individual taking the assessment is shown an ink blot or is given a word, and they are to communicate kind of whatever associations they make with that picture or that word, right? And those associations are then what are interpreted, that their response to that ink block, right, are interpreted and scored. Okay. Another type of projective technique would be story construction or sequences. So the individual is given instructions to create a story, right? And based on the content of that story, that response, again, is categorized and interpreted. The third type would be sentence or story completion. So maybe they are given the start of a story and asked to finish that story, or they're given the start to a sentence and then their response is to finish that sentence, right? And again, that response is then categorized and interpreted. Another type would be picture arrangement or selection of verbal choices. And then the last one would be drawing or play techniques. Okay, so the use of drawing or how an individual plays. And again, all of this, they're given something very ambiguous. And so the idea is that the way that they respond to that, right, is going to communicate what's going on within them, right? What their needs are in that moment, what they've experienced in the past, how they're thinking about that, etc. All right, so I'm going to talk about two of probably the most popular projective assessments. The first one is the Rorschach's ink blot test. You've probably seen this before. It is the most widely used projective test. With this assessment, there are 10 different ink blocks that are given to the client. And the client then responds to that ink blot. There is a scoring and a scoring scheme. And so how those responses are scored are based on location. So what part of the ink block did the individual focus in on? What was the determinant that they focused on? Was there a specific feature of that ink blot or a color that they were drawn to? What was the content of what they talked about and described when they saw the ink blot? And then and then assessing kind of the popularity of what they talked about. Is it something that people commonly respond? Was the content kind of in the category of something that people often talk about? Or was what they were talking about pretty unique, right? So based on all of those areas, location, determinant, content, and popularity, right, the response is then scored and interpreted. Right? In a similar manner, using drawing, you also have the house, tree, person assessment. So in this assessment, an individual is asked to draw a house, a tree, and a person on different sheets of paper, right? So these will all be individual drawings. Then the individual describes, defines, and interprets each one of the drawings. So they go through a process of describing each one of those. And then the characteristics of the drawings are scored and interpreted in an interpretive, yeah, okay, sorry. My PowerPoint, I don't know what I was trying to say there. Anyways, characteristics of the drawing are scored, and then there are some interpretation guidelines that are applied to the characteristics of the drawing itself and to the responses or descriptions of the drawing. So if you look in your textbook on page 298 in table 13.3, you see some examples of what some of those interpretations might be, right? So when you're looking at the drawing of the house, you're really wanting to understand the atmosphere of their home and the intrafamilial relationships. So what are those family relationships like, right? And then it has some guidelines in this table of looking at, okay, if the house is really small, they make it, maybe the house is in the distance, or it's a very small house, right? The interpretation of that could be that there's some sense of rejection of the home and the home life, or a sense of withdrawal from the home. If the house has really small windows, right, that might mean a lack of interest in people and psychological inaccessibility, right? So these are some of those things that you're looking for and how you're interpreting. For the tree, you're looking to understand how an individual experiences their own environment, right? So if it's a really large tree that they draw, that could mean possible aggressive tendencies or overcompensation. If there are lots of branches, excessive branches, that could be possible obsessive compulsive or manic tendencies, right? We're looking at how they experience their environment. And then for the person, we're wanting to understand how they view interpersonal relationships. So if they draw themselves and they have folded arms, maybe they are someone who deals with a lot of suspiciousness and or hostility. If they didn't give themselves a mouth in the picture, that could mean the feelings of guilt, depression, or possible psychosomatic problems, right? So all of these things are part of those interpretation guidelines, okay? And looking at how the individual projects themselves onto the ambiguous task. So a couple of examples here. Here's one of the ink blots that's commonly used. Again, remember you're looking for kind of what part, what location does the client focus in on, what determinant, were they focused more on the red color over the black color, what was the content of what they described here, and then how popular was that content that they described. And then here's an example of the house tree person example, right? So you have the 3 individual drawings. You're going to be looking at, for the house, the size of the house, where it's located, are there windows, are there doors, is it the front of the house, the back of the house, right? For the tree, is the tree trunk present? How big is the tree? How small? How many branches are there? For the person, what physical features does the person give themselves? What is their kind of physical stance? Those are the types of things that the person administering the test are going to look at as they score and interpret those results. Okay. So that is a quick overview of personality assessment. So to review, when we're talking about personality assessment, we have both structured assessments and unstructured assessments. These some assessments that look at diagnosing psychopathology or behavioral problems, other assessments that are used to better understand the intrapsychic functioning of an individual and interpersonal functioning of an individual, right? So all of these types of assessments have a purpose and a role in your work with clients, and there are different things that can indicate their use, right? If there seems to be dysfunction in personality functioning, right, having an assessment that really looks at kind of helping you in that diagnostic process can be really important. Or if someone's having issues kind of in their daily functioning, in their relationships, in kind of deciding on a career or on a future, right, looking at some of those assessments connected more to personality styles might be something that can be helpful as you work with those clients. So I hope this was helpful in giving you an overview. As you move forward in this module, I have here your to-do list. So once you have listened to this PowerPoint, I hope you will read all of chapter 13. There is a module activity for you to complete where you will look up, you can choose one of the structured assessments, and you can look up that assessment and kind of critically think and analyze that assessment based on validity, reliability, multicultural issues, all of those things to see how that assessment stands up with that criteria. And so you'll be doing some of that in the activity, and then there will be a quiz over chapter 13. This will have both multiple choice and true-false questions. All right, good luck.